Welcome to Health Authority TV. My name is Devin DeVries. I'm the editor-in-chief of Health Authority Books. Our mission here at Health Authority TV is to bring together a community of health business experts and find out what's happening currently in their areas and also look to the future possibilities. Our guest this week is Colt Briner, author of The Race to Relevance. Welcome, Colt.
Thanks very much.
Yeah,
Glad to
it's so
be
nice to
here.
see you.
Great topic.
Yeah, well, to dig in, we'd love to know kind of, who do you serve as a health authority?
I've been working for 15 years in the back office of American healthcare, supporting organizations mostly as a leader in communications and marketing. Currently serving as Chief Marketing Officer for Trend Health Partners and Principal Advisor for Scrappy Marketing.
Nice. And then, what services do you provide in that area?
Well, I mean, I think of it as reverse engineering revenue, right? So delivering these organizations to their revenue goals, understanding the markets that they're going after. And in high ticket B2B, it's all about getting them into the conversations that they need to be in order to reach their revenue goals. So that's a pretty broad spectrum of services, right, that I would cover. Mostly it's setting them up with the strategies and tactics that they need in order to engage their marketplaces. My clients typically are younger organizations. They've finished their founders selling, they've finished their referral selling, and now they're entering the market where no one's heard of them, and they need to build out a plan to get that done and to reach their growth targets.
Nice. And I know as the author of The Race to Relevance, you also talk a lot on purpose
I
and
do.
how that drives organizations. Is there crossover there in the health space?
Very much. Yeah, actually, like quite a lot. And especially these days, the importance of purpose centered messaging is a little hard to overstate, especially with, I would call it the dire circumstance that American healthcare is in. Organizations that really can deliver our system to a better performance, a better ranking on the world stage, better outcomes. This is so critical, right? And so much of American healthcare is nonprofit, it's mission based, and for those organizations, that alignment is key. So to see that in your messaging, both internal and external, is highly recommended. Operationalizing purpose within your companies is how you make that genuine.
Well, I know you have lots of great tips in the book, so we'll make sure we include a link for our listeners in the show notes to check that out. But also, it was a good segue into this conversation we are trying to have as the community that, based on your experience as a healthcare authority, how would you redesign America's healthcare system?
Well, from the lens that I have, it's in trouble. I would say that you could even say that it is on fire. I don't know if it's in the dumpster on fire, but there's a lot of problems.
It's close.
It's close. You're so right. And for people who ask me about my space, I tend to say, look, some rocks you just want to leave unturned, just not want to have to see what's underneath it. I would say that there is so much friction, so much abrasion, so much angst and difficulty in the back office of American healthcare, and that's the interchange between the providers, which would be the health systems, right, the hospitals and clinics, et cetera, and the payers, which would be the insurers and the government agencies, et cetera. The machinations of process that exist between those two parties today represents a massive cost. It represents a massive cost that is being borne by the people who have out-of-pocket costs in healthcare and the people who have plan subscription costs, right? Your premiums on your health plan. That's where you're seeing that cost. And the first thing to think about is, if we've really been in an arms race between payers and providers, fighting over this hypothetical gray area of dollars, that if you have stronger technologies and a bigger army of people, you can capture more of, then we want to step back and think, when do you cross the line from where you're spending more money on fighting than you're getting back for being in the fight? And my opinion is we've been over that line for years. And what I'm really excited about is that there is now this nascent movement, and the company that I'm working with now, Trend Health Partners, is actually playing a very significant role in this, to move the industry away from the adversarial dynamic, the us versus them, payer versus provider situation, into a more transparent, collaborative, and trust-based interaction where you can stop spending money on the weapons of technologies and artificial intelligence that they're using against each other, and start working instead towards, okay, how can we, through a mode of cooperation instead of antagonization, get to the outcome that works for both parties so that the patient slash plan member ends up in a better spot. So I love that as a first step. Second, American healthcare in general, what most people have identified as the core problem is it's counter-incentivized. At least it's counter-incentivized for health, meaning as it stands, the more ill people are, the more expensive the treatments are required, the more money is made in the system. This is a fee-for-service system. We've been in fee-for-service for decades, well, since our system started. But we have also a nascent amount of progress, slowly gaining traction towards value-based care or risk-based models, wherein rather than being paid on a fee-for-service basis, what you have would be relationships between large employers and health systems where the employer would be paying the health system on a per member per month basis. And it would be the health system's responsibility to maintain the health of that population, rather than just to be responsible for, performing the procedures and providing the medications. If the health system wants to make a margin on that membership monthly contribution, it's up to the health system to make sure that high-cost disease states and procedures are avoided. And the best way to do that is through maintaining a state of wellness and health for that employer's population. That, I think, it is the best way to get us into a system that will start working for the patients. And I'm excited about that possibility.
Yeah, I think we're hearing that a lot. We need to get further upstream with this. When we're waiting for people to be very sick,
Yes.
it's too late to
Yes.
really affect things. And some of that just comes down to better education
It does.
on how to be, wellness practices and how to, get ahead of some of these things. So I think that is a big driver of this conversation is how do we get more people engaged that way.
Totally agree with that. I think that the third and last thing that I have in mind for this would be it is going to have to come down to moving faster in the adoption and integration of new technologies. American healthcare as an industry has been characterized as being 10 or even 20 years behind other industries in terms of the adoption of technology. And at the same time, there are very promising technologies emerging. One of the companies that I work with, I have worked with through Scrappy, is DeLorean AI. And they have a technology that I think is absolutely remarkable, wherein their AI is able to identify within a health system's patient population specific patients who are going with very high likelihood, and I'm talking like the prediction accuracy rate is in the high 80s now, that this specific patient is about to have either an episodic event like a stroke or a heart attack, or they're about to transition to a more advanced state of a specific disease, right? So if they're in a pre-diabetic state, this AI can inform the clinical staff, this individual is about to have type 1, right? So that is a much higher cost disease state for that health system and for the insurer. Right. And obviously a stroke or a heart attack is a very high cost episode. So if you can have technologies identify patients who are at risk for transitioning to high cost disease states at a time when it's preventable, that's an amazing promise for our health system, not only for preserving the health of those individuals, but reducing the cost of overall care for the population. The challenge is there's an attitude in American healthcare that's basically something like, if we go fast, people die. So we take things very cautiously. We move very slowly, pragmatically, cautiously around the adoption of these technologies. And I think that there's value in that. At
Mhm.
the same time, we have to start asking the question, what are we actually protecting if our system is ranking among the lowest on the international stage among advanced nations for the overall health of our people, for infant mortality, for overall lifespan, which in America is actually on the decline? Are we have we gone too far in the energy of protection and going slow, so that we're protecting a system that's actually causing more harm? And we need to look to find ways to accelerate and adopt technologies like DeLorean AI so that we can actually progress towards a more effective system.
Yeah, that's really interesting to hear how high the percentage rate is on their
Yeah.
ability to do that. Um,
Yeah.
though, though, I mean, it makes me think back. I worked in e-commerce analytics, and the big story 10 years ago was when Target could predict when somebody was going
Yeah.
to get pregnant. So the
Yes.
amount of data that we have, and I know in healthcare, then it starts to get into the like the privacy laws and all of that. But
Yeah.
it's true that, this data could be very helpful if we just find the right way to utilize it and
Yeah.
assist the doctors. Um, Another person had also talked about time saving things with AI that
Sure.
allow the doctors to be more involved with the patients instead of less, which I think was a fear that people had, that you're dehumanizing health. But really, if we're freeing them up with some of the, admin tasks, then really
That's right.
they can connect more with the patient. So I think, I
Yeah.
know AI is a huge topic, and there's a lot of, concern and conversations there, but it is the future. We just need to find the right path to use it.
I think you pointed out something actually really, really valuable just now. So one of the more promising technologies that's emerging and being adopted very quickly is called ambient documentation, which allows AIs to basically capture what's happening in the clinical setting,
Hmm.
which is intended to relieve the burden from the physician and the clinical staff from all the record taking that they're responsible for doing, right? The documentation, the transcribing, etc. And if we can actually be effective at now reducing the burden that we've been placing on the clinical staff to interface with these digital systems and find time to do so, we will find that they can be freed up to spend more of that human to human time that you're talking about. And I think that that would be wonderful.
Yeah. Well, I really appreciate you taking the time to share some ideas and thoughts. And for
Yeah.
our listeners, this is a conversation we want to keep having. So we'd love to hear your thoughts and ideas in the comments as well. And we will see you next Tuesday. And until then, may you be healthy, wealthy, and wise.